Should we ban assault rifles? This is an important discussion that we've been dealing with for years, and as an interventional radiologist, I wanted to talk about it from the perspective of a physician and as a healthcare issue. As a radiologist, we see all kinds of people who have been shot with handguns, and occasionally people who are shot by assault-style weapons. And the difference in injury patterns is stark, and I wanted to show you guys some imaging to show you the significant difference between the two types of injuries. A study published using images from a United States military base of people who were injured and shot by assault-style weapons really helps us get a better understanding of what happens when someone is shot by an assault-style weapon. So here on this side, we have a picture of someone's leg that has been shot with a 9mm gun. And right over here, you can see there's a fracture of the tibia, which is the main bone in the leg. And the kind of dark parts of it show the comminuted fracture, meaning it's a multi-part shattered fracture. But the bones aren't really displaced that badly. And these tiny kind of white dots all around show the scattered metal fragments from the gun bullet. And the soft tissues here really don't look that bad. Compare it to this picture right here. This is someone that was shot by an assault style weapon, and you can see that the tibia is fractured, the fibula is fractured, and you can see there's extensive soft tissue injury. In fact, there are parts of the tibia's bone that's not even there anymore. I don't know where it went, but it almost looks disintegrated. And side by side, you can see the difference between someone who has been shot with an assault style weapon and someone who's been shot with a 9mm handgun. The soft tissues injuries alone on this person is going to have significant effects on their mobility and whether they can walk or not. Who knows how many nerves have been hurt, how many arteries have been injured, etc. Over here, probably some arteries have been hurt, but no major nerves probably are injured, and this person will probably be able to walk again. On this side, because of the extensive soft tissue injury, not only is there an issue with whether or not the bones are ever going to heal, but there could be major infections that result in amputation at some point. This is another picture of someone who was shot in the arm with a assault-style weapon. Again, it's a comminuted fracture. You can see these bones are completely shattered and displaced. This is going to result in really bad deformity. There's probably a high risk for soft tissue infections, and the risk for amputation eventually is not low. That doesn't even account for the fact that major arteries are in this region, and then major nerves are also in this region that can affect hand and arm function. So this one is absolutely crazy. This is a CT scan of the head of someone whose head was grazed by a bullet. And it's absolutely nuts the kind of injury this person had. So again, this bullet just touched the scalp of someone because of the shock wave and the force that was transmitted by the high energy assault style weapon bullet. There's a fracture of the skull over here. Another picture of this skull shows another fracture down here. This picture right here shows blood in the brain parenchyma. This bright stuff over here is not metal fragments. It's the bones that were transmitted from the skull into the brain parenchyma, and these bones basically acted as little shrapnel, kind of disrupting all kinds of brain tissue. Again, this bullet never actually penetrated any of the skull. It's just the force that it transmitted to the skull that resulted in bones sliding into the brain and just messing a bunch of stuff up. This is another picture of that same patient's brain. These are the ventricles in the center of the brain. That bright stuff in the center of it is blood. So the shock wave and the trauma from this bullet, not only did it send bone fragments throughout the brain that injured so much of the brain, but there's also blood throughout the interventricular system, and there's also extensive injury to the brain tissue itself that we can't see. What's absolutely nuts is, again, this bullet did not penetrate into the skull, but this patient ended up dying just from the force and trauma related to the assault-style weapon. In contrast, I've seen plenty of people who've been shot in the head by normal 9mm handguns and survived, with the bullet actually penetrating the skull. This is another crazy one because this person had been shot up kind of through the face. The bullet kind of traveled downward and ended up above the clavicle. Again, this highlights the power of an assault-style weapon. Look at the bullet. It stayed intact all the way coming down from the mandible down into the shoulder. This over here is the patient's jaw, and that bright stuff is shattered tooth. It's not bullet. Not only did it break a bunch of teeth and cause all that kind of injury, it also went through and broke some of the vertebral bodies of the C-spine of the neck, and there's a bunch of shattered bones kind of scattered everywhere. And again, because of the extensive trauma and shock wave from the bullet that hit this person, it resulted in an anoxic brain injury and injured their brain to a really bad level, and this patient ended up not surviving either. This is someone who was shot up in the chest. The bullet traveled downward and into the liver. You can see this kind of little bright spot right here, and the arrows over here kind of marked a trajectory. On its way down, that assault-style weapon bullet, probably an AR-15, shows it injured the lung over here, extensive injury to the lung, extensive injury to the bones. The bullet ended up in the liver. All this kind of gray stuff here is dead liver. All that bright stuff is metallic fragments from the bullet. And over here of the lower part of the chest, you can see the side of the chest wall has been blown out. And not only has it been blown out, but there's colon, gallbladder, and some parts of liver that have herniated out of the chest wall and just kind of hanging out into the side of the chest. That's all from one bullet, one assault style weapon. Again, I've seen a bunch of people that have been shot with normal handguns, and the kind of injuries that happen from this assault style injury is nothing in comparison to what happens from these handguns. And I've seen people get shot in all kinds of places. Now, if you keep in mind of that last picture I showed you, this is a great comparison. This is someone who was shot up in the neck area, and the bullet kind of traveled down and ended up in the liver over here. But this was a handgun. So bullet is in liver, or the area of the liver. On this CT down here, it shows that it actually ended up behind the liver. Didn't really injure any of the liver itself. It fractured the spinous process, the back of the spine, but again, not enough extensive trauma to actually disrupt any of the nerves or arteries in that area. Again, this series of pictures really highlights the fact that this bullet went from the neck, fractured some of the bones in the spine, but not the kinds of bones or not the area that would affect any kind of function for this person. It traveled down, ended up by the liver, didn't injure any of the liver, only fractured the clavicle up here. The ballistic injury and shockwave related to the assault style weapons themselves cause so much significant harm, and the bullet designs themselves are designed to cause so much extra injury that two people that have been shot by the two different weapons, a handgun versus an assault style weapon, can have significantly different outcomes. You can get shot in a non-vital area by a handgun and survive, but if you get shot by an assault style weapon, even in a non-vital area, it can cause such a tremendous amount of injury that the prognosis can be pretty poor. Ultimately, this is the most important thing to talk about and consider. The ultimate question is whether people with mental health disorders should have such easy access to weapons. The debate is not at all about whether or not people should be allowed to have guns, but rather it's about how we regulate who can get guns. We have regulations on how people can get narcotics, on how people can drive, on who can drink alcohol, etc. And too often we've seen these kinds of mass shootings with people who have known and diagnosed conditions. And a lot of times these are people who have been seen by medical professionals. And unfortunately, the fact of the matter is there's a huge difference between assault style weapons and the kinds of injuries they can cause and the clinical outcomes of these patients. My goal here is not to really have that political debate or change anyone's minds or anything like that. I just wanted to show you guys the imaging features and the differences between someone who's been shot with an assault style weapon versus a handgun. What's y'all's thoughts after seeing these pictures?